Okay, so you have been prescribed the Denneroll cervical pillow. I'm going to instruct you on how to use it and place it properly. It's important that you keep in mind that you follow the doctor's instructions exactly when you're doing this. So whether they tell you to do it on the lower, middle, or upper neck, that's exactly where you need to put it. If you're not sure, even after watching this video, please consult with one of the doctors before using it so we can make sure you're doing it in the right place. So you're going to get your pillow. You're going to open up the box, and in the box you'll see two things. First, you'll see your pillow wrapped in plastic. Second, you'll see the Denneroll Neck Orthotic User Guide. This also has some helpful pictures in here to make sure that your neck is lined up properly on the pillow according to the prescription. So you can look at this as well. Okay, so when you're using the pillow, it's important that you keep in mind there's a couple areas on the pillow to notice. This top portion, this is where your neck is going to be draped over, whether it's the lower, middle, or upper neck. This is the portion that your neck is going to be on. And then this portion here, it says shoulders this side. It's like this little slope here. When it says shoulders this side, you need to make sure that your pillow is this side of the pillow is facing your shoulders, no matter what level your neck needs to be at. So when you lay down, you're going to start with just 30 seconds for the first time that you do it. After the 30 seconds, you'll get up properly, which I'm going to show you how to do. If you notice any soreness or discomfort after doing the pillow for the first 30 seconds, that's okay. That's normal, because what we're doing is we're rearranging some things in your body, and it's normal to be a little sore. But if you notice soreness, you're going to stay at 30 seconds per day until you don't have soreness anymore. Then you'll increase slowly, going up by 30 seconds each time. You'll remain at that 30 seconds or 30 seconds higher than that at 1 minute. You'll remain there until you're not sore again, and then you'll move up to 1.5 minutes, and so on and so forth until you're doing 7 minutes total on this. So if you don't have any soreness after your first day, you just move right up to 1 minute for the next day. A couple things to note about using this Denneroll pillow. One, you want to make sure that you're doing this on the floor. You want to be laying on a hard surface when you're doing this. You do not want to use this on your couch or on your bed. They're too soft and your pillow won't work properly. So make sure you're doing it on the floor. Secondly, when you're doing this, you want to be laying down, and when you're laying down, you want your knees to be bent. So you always want to keep your knees bent in order to reduce any pressure or discomfort for your low back. It's important to keep your knees bent. Lastly, what you want to make sure that you're aware of is, I know I said when you are increasing from 30 seconds and moving up in your incremental, moving up to doing it longer, what you want to be aware of is, I know some of you already have neck pain. If you already have neck pain, all you're looking for is just making sure that the pillow isn't increasing that further or increasing soreness or discomfort further. So as long as it's not causing any increased soreness or discomfort, you can move up to the next level. Okay, so if you're doing this on your lower neck, you're going to place this down. Remember, your shoulders are going to be on this side, and your neck is going to go over this top portion. So you're going to lay back. And it's helpful to have a spotter with you the first time you do it, just to make sure that you're lined up the way you should. So if you're doing the low neck, you're going to have this so far down that it's almost like your shoulders are on the pillow. But you want that little hump that's in the back of your neck, you want that to be draped over the highest part of the pillow. You're going to lay here comfortably for 30 seconds. After the 30 seconds is over, you're going to roll onto your side, move the pillow out, roll back onto your back, lay here for approximately 30 seconds, and then slowly rise, and you're all done. Now, if you're going to do your middle neck, it's the same concept. So you're going to have the pillow placed here, and you're going to lay back with the middle of your neck over the pillow, just like so. Again, it's helpful to have someone there with you the first time just to make sure you have it in the right position. And then again, you'll remove it the proper way. If you're going to do the upper neck, your neck would be placed here, just like this. Again, after 30 seconds, you would roll to your side, pull the pillow out, roll back to your back. So after you pull this out, you're going to lay back onto your back for 30 seconds. After you've been there for 30 seconds, you're just going to sit up, and you're done. And then, like I said, you're going to make sure that you do this on the floor. You're going to make sure that after you do it each time, if you're sore, you stay at the same length of time for the next time until you're not sore anymore. If you don't have any soreness, you're going to go up by 30 seconds. If you have any questions, please ask your doctor because they would be more than happy to help.
Hey, we're adding this to the end of the video because I've noticed for some of you who've been prescribed the Denneroll for your neck, you've said that when you lie down on this it kind of hurts, and I can see that it could hurt if your neck is shorter than the average person. Then that would do that. So here's the solution for you. If you find that it's painful, what you do is you take a towel, and this is just a regular bath towel, and fold it up a couple times. And depending on how thick you want it, you can even fold it a lot more like this. And then you put this here where this is. This will elevate your upper back just a little bit so that when you put your head over this, this won't seem like it's so high. So it'll look like this. So for me, this doesn't feel like much of a stretch, but for some of you it would be. But you can see it raises my shoulders and my upper back up just enough so that this doesn't seem like it's pushing so hard. Without it, as you saw earlier in the video, it would look like this, and it seems like a much higher push. So you can use the towel, fold it up as much as you need to, and start with that. Hopefully that helps you.